Turning our attention today to a topic that a lot of men don't always want to talk about. Prostate cancer, the most common cancer in men, the second leading cause of cancer deaths in men, and experts say early detection is crucial. That's why we're talking about it today. This information, as we know, can be life-saving, but there's an issue. How to screen for prostate cancer can be confusing. As we welcome in our medical expert, Dr. David Winter from Baylor Scott & White Health to explain. And Dr. Winter, appreciate you hanging out with us today. Who should get screened for prostate cancer, and how do they do that?
Yeah, all men over a certain age should be screened by one of two ways. One's a blood test, PSA, prostate-specific antigen is one way. Also, on a physical examination, a doctor can actually palpate the prostate. Now, how often to do it and when to start, it depends on your risk factors. If you have two close relatives in your family, say a father and a brother or two brothers, you should start at age 40 with screening. If you're African American, or if you have one close relative, that's starting at age 45, and for everybody else, start at age 50. Screening should then be once every year. Some people say once every other year, but on a regular basis thereafter, Mark.
I know that I've heard some questions about PSA numbers before, people trying to make heads or tails of them. How reliable are the screening tests, and why are there two out there that experts recommend?
Yeah, the issue is the prostate can get irritated, and any irritation can cause the PSA to go up. For example, a prostate infection, prostatitis, can send the PSA up. I had a patient of mine who rode a bicycle, long distance bicycle, in a narrow little seat. That irritated his prostate. PSA went up, came back down in a couple of months. So the test itself, the blood test, is not totally reliable. Now, the examination also can help. Most folks actually detect it with the PSA going up first. But there's been a few cases, in fact, a small percentage, where the PSA is normal and they can feel it on examination. So both are recommended by most experts.
What causes prostate cancer?
Yeah, we don't really know for sure, Mark. It clearly is more common as we age. Now, obesity is said to be a factor. Heavy alcohol consumption is said to be a factor. Now, there are other tests you can do that kind of help to figure if there's cancer or not. The MRI scan can see if there's actually a defined nodule. That can be helpful. But the diagnosis is typically made finally with a biopsy. You have to biopsy. Biopsy will tell you if it's cancer, also if it's aggressive cancer or mild cancer. Some prostate cancer are mild and can actually be monitored and watched without treatment.
Well, some great information, Dr. David Winter, and maybe we have helped prompt an uncomfortable conversation someone's willing to have with their doctor they wouldn't have otherwise. Thanks for hanging out with us today.
Good to be with you, Mark. Thank you.
Midday will be right back after this break.